I like the outlet. I like the not outlet. All of it to me
Collar
is
up.
that's very funky. That's very like we're going
Smoking
jets,
cigarettes.
schmucks, right?
Okay.
Okay, our theater
Well,
days.
it's nice to see you today, Maria. This is a podcast about brain injuries. Welcome to Brain Injuries, Schmain Injury.
One,
On today's
two.
episode, we are going to discuss how we know each other, a little bit about our individual experiences with brain injuries. You are a mental health counselor who specializes in TBIs, PTSD, right? And
That's right.
you suffered your brain injury 19 years ago. I am a certified public accountant. I had my brain injury on the first day of studying for my CPA exams. So it set me back, but I was able to accomplish that goal. And yeah, so today we'll get a little background and then we'll take a listener call and then talk a little bit about some tips, right? That help
Yeah,
us get through life, whether you have a brain injury or not.
that's actually really true. I think that all of this stuff could be applied to anyone, but I think it's really useful when you're kind of looking for a compass. And I know for me, when I think back to 2006, when I had my injury, like I just, I think we had a
And you're using the
computer.
same cell phone you had back in 2006, right?
I don't think I had one. I think someone got me one, but I mean, I just feel like it is so isolating to have a brain injury, and I think that's really true across the board. Like whether you have a mild brain injury or concussion or a really severe traumatic brain injury, it can make you feel super alone because you're not only like getting to know how to be in the world again, but you're also getting to know yourself again and trying to like ride out emotions and all that sort of thing. And when I had my injury, I just remember thinking like I wish there were groups for this, or I wish there were something I could connect to online, which again, like I probably would have had to go to the library because I don't think we had a computer at my parents' house, but
Really?
or maybe we did. I just can't. I feel like, yeah, I'm not 100% sure, but I just, I find it really cool to be able to sort of bring this to people and then also thinking about your experience and doing something so huge like studying for an exam like that that's difficult for anyone. It is much harder when you have a brain injury. It's a disability. And so, yeah, hopefully we'll get to talk more about that.
Yeah, totally. Um, yeah, I guess I'm sort of drawing a blank on how to transition into the next subject. Or
I think kind of next on the list was that how we met, a brief introduction or skipperoonie of that.
yeah, I think that's pretty good. I mean, I guess just to think a little bit about kind of your 19-year journey, like I feel like it might be interesting for people to hear how you came to be a mental health counselor who specializes in this because you wore a few different hats before coming to this place of like providing professional help to people who've had similar injuries to
Mm-hmm.
you and beyond. Can you speak to that a little more?
Sure. I mean, I think definitely when I think back to my experience being in the hospital, I lived in the hospital in Montana for like 3 weeks and then came back to Washington for more of my recovery and lived in the hospital here at University of Washington for also I think like 3 or 4 weeks before going home. And when I was in the hospital, especially when I came to Washington, like my family and friends and everyone who lived here would come and they would be like, some people looked at me and just cried because I think since I was bald, and there were like huge scabs on my head, and I had all of these like braces to hold my body in place. It was really disturbing for people to see. And I also recognized that, like, if I looked so scary, it must have been very scary what happened to me. And I really didn't know what that was. And my mom and dad did a great job of like making sure people were always around me and I was never alone in the hospital, which is really hard to do.
Yeah.
However, I have like 26 cousins and I just have a huge family. And so we were able to do that. But I never really got to talk about what I was thinking or feeling. And
And you
even like
wanted
this,
to, or
I wanted to, but I was really scared. I was scared because it almost felt like being in jail. Like I had to do certain things. And there was this one time I was really sick. I got like a hospital contracted virus where you're basically just like pooping constantly and like
shit,
woke
do
up.
I have that every day? Is that
I hope not, because it was like I woke up in my own feces. It was like behind my ears, in my arms and legs, and
like got
it
behind
was
your
just,
ears?
yes, it had gotten everywhere.
Oh my
Um,
God.
and the next day, the nurse came in and was just like, you have to go to physical therapy. If you don't go to physical therapy, your insurance won't pay for your treatment, won't pay for you being in the hospital. And I feel like every person knows that the hospital is the most expensive place in the world. And so even though I could like barely move because I was so depleted from pooping so much, I like pushed myself and, you know, took like micro steps down a hallway because I was just really learning how to walk again, and like move my arms because I had broken my neck as well. And so things like that, I probably would have processed with someone. There was no one to process it with. And I wanted my family to see me as really strong and think that I was getting better and that I was happy inside. And so, like you said, I went back to New York like years later, and that's when we met. And I was like doing acting and going back to school. And then later teaching yoga. Anyway, but then it all kind of just came to a head when I was working back in a hospital and actually working with cancer patients. And I was just like, this thing, it was younger cancer patients, and this feeling was still there of like people want to talk and they can't.
Because there's nobody to listen, or because they feel like they're going to be ostracized, or there's a stigma,
Yeah,
or what, a
I think they
combination, you
feel
think?
protective of themselves and like wanting to have agency over, I'm a 23-year-old and yes, I'm sick, but I'm also like, I don't need my parent to baby me. I want them to see that I'm strong. And yeah, I just think that's really what brought me there. And even after having some therapy, which I did previous to starting my own counseling and becoming a counselor, I think that it was like a lot of times people didn't really understand brain injury, and that was difficult.
Right. I mean, I think probably one thing we'll talk a lot about is just self-advocacy,
Mm-hmm.
which
Mm-hmm.
is just kind of, again, another like mental health component, like,
Yeah.
but also just another life skill that in our modern society, like you have to constantly be advocating for yourself.
And
Um,
I think with brain injury, it's extremely difficult to advocate for yourself because it takes a lot of like being on top of things, calling people over and over again, things that if you're a person with a brain injury and you're fatigued by 3 o'clock in the afternoon and you're still working or working a part-time job, it's like, how can you ever get your brain to function in the way to make that call?
totally.
Yeah, I think it's a really big problem, and I'm glad you brought that up.
Yeah, I mean, do you have any quick tips? I know that's not, we're we're jumping the gun on our quick tips segment, but I do think that yeah, fatiguing early afternoon and having to power through, and in your case, rallying the family and managing a household and
Yeah.
managing clients and work, and it's a lot for anybody. But I think this whole layer of brain injury is a nice kick in the pants on a daily basis. And to go back to our intro, like part of why we wanted to have these conversations was to highlight the ability to have a full life and acknowledge this shit fucking sucks, right? But you can still push forward, ideally.
Yeah, and I think it
You're not
is like, right, you're not alone. And I think it's also like have a full life. And part of that is being really aware of like when I want to go to a beach day, I probably need to have a really calm day before that day and after that day. Or I might need to say no to meeting a friend the night before at 5 o'clock, because if I do that, then I'll be still tired when it's beach day in the morning. Like, so it's also like making those edits and finding what's most important to you so you can have a good life.
Yeah. I mean, I had a incident with my wife the other day where she was helping me with a work thing, and she was, I had asked her for help and she was helping me, but her reply was like 7 sentences, and it was just like 6 sentences too many. And in the moment, I felt, and I told her, I felt like a little bit like I'm drowning in your response, and
Mhm.
I'm really sorry because I know I asked for your help, but I need to unpack this like sentence by sentence. And I think she understood. And I think this is also the result of the brain injury is like we're
Totally.
the only ones thinking about it regularly.
Right.
We
That's
can't
right.
always expect people to be like, remember, I have a brain injury. I need you to slow down. And it's like, okay,
Yeah.
so we always have to have some qualifier to be able to speak to somebody. But sometimes it's just too much.
Well, right. And sometimes it's not appropriate, like with someone that's an acquaintance or someone that you work with, but's not really your boss. Um, yeah, I totally get that. I had a similar experience with my spouse yesterday where I was like trying to show them a text someone had written me and it didn't make any sense to me, and they were like, well, I think that this is what it might mean. And I was like, don't say this is what I think it might mean. Imagine you're telling our 6 year old that there's no monsters under the bed. You're not going to be like, if you want my opinion, there's probably not a monster. You're just like, no, there's no monster. It's like, that's how I need you to talk to me right now. Just be very, very clear. Don't say this is your opinion. Say this is what it is. That helps me to then feel like, okay, I trust what's happening and move on. And yeah, it's a funny one too, because this morning the person wrote me a message back and was like, sorry, I totally misread your first message. So it's like, I wasn't being crazy, but I think that's a brain injury thing as well, as there can be a lot of second guessing. And it's like, did I read this text totally wrong? Like, I'm thinking that. And then, 7 hours later, my friend is like, no, it was me. I read it wrong. Like, yeah.
Yeah, I think that's a little bit of I guess the benefit of the brain injury is you're like, I think everybody else is fucking crazy too.
Well,
Right?
that's a good place to be. That tells me you're a confident person with a brain injury. I would say
Right.
that definitely isn't how I think about things all the time. I assume it's me that's wrong.
Oh, well, let's work on that. As
Okay.
we progress, we will work on ourselves as we try to help others. Yes? Well, I guess that's a good point to maybe try to have our audio message from a listener.
Yeah,
Do
I
you
love that.
agree?
I concur. I
I got it.
concur.
I
I concur.
let's hear some more voices.
Okay.
Okay. I successfully saved the audio message to my own voice memo, and so I have it saved and ready. Are we ready for it? I gotta put the volume up. I was not prepared completely.
We're ready, Freddie.
Hi, my name is Will. In 2006, I got in a boogie boarding accident. While not formally diagnosed, I think the result of that accident might have been a traumatic brain injury. In hindsight, I strongly believe I had a concussion. I have really poor long-term memory, and my thinking has become very black and white over the years. Sometimes I feel like I follow rules too closely. I wonder if these characteristics have to do with the TBI that I think I experienced.
Hmm.
Thank you, Will, for sharing
Yeah,
that.
and for anyone that's watching this on video, I'm sorry, it looked like I was laughing. I just the word boogie boarding. It's a funny word, right? But it had nothing to do with
Yeah,
Will's call.
we're not trying to minimize his
No, not at all.
experience, but
And like the first thing that jumps out to me is just like I think he said I think I had a concussion or something like that. Um, and that's such a tricky thing because it's like you go through life with all these behaviors or symptoms or things like that. And like for some people, then they find out because they have an MRI or something that they actually did have a concussion or they did have a traumatic brain injury, or maybe you find out through something else. But it's like it stinks to have gone through however many years he's describing, not knowing whether, you know, oh, now everything's just harder for me, or
yeah.
okay, I
And
had a brain injury. I know why.
yeah, I mean, this is an assumption, but even if he probably did get imaging or something done, like probably wasn't that helpful, or there was no like guidebook on how to
Yeah.
proceed with it. I know that from my own experience that going to see the doctor and getting imaging done didn't net any positive results, really. Uh,
Yeah.
like it was only once I contacted you that you sort of were able to provide context to what I was experiencing.
Hmm. I don't think I knew
Not
that.
to blow smoke up your ass, but no, really. I mean, who did I have to
Wow.
talk to about it?
Yeah. Yeah.
Uh,
Yeah. And I guess that's a really good point. Having the right provider or even just having a good provider, you don't really know. And so going to a doctor and thinking they're going to help me and then ultimately them maybe not being able to help you, it not only is discouraging as the traumatic brain injury patient, but it is also like, what do I do next? So I hear you kind of saying that that's a possibility for Will. Like even if he had known, it may not have helped. But even just knowing you have a brain injury, do you think that makes it easier for you when something's difficult in the world to be like, that's not just me, that's my brain injury?
I do now. I mean, just citing that example with getting that help response from my wife and having it be
Mm-hmm.
overwhelming, I think realizing in the moment, oh, this feels overwhelming.
Yeah.
This this could be connected to my brain.
Yeah. Yeah.
So
And with that, did she end up slimming it down to like the sentence?
she did. She
Yeah.
did. She understood. Okay, I'm sensory overload, information overload. Let's break this down more simply.
Yeah. So sort of like advocating for yourself even in that situation,
Totally.
which
Yeah.
is huge.
Yeah.
Yeah. And
Which,
and
but
maybe
so please.
I was just saying maybe that's part of it too, is like if you know I have this brain injury, then you might feel more confident in asking for your needs. Where if you're just like, oh, you know, like he was saying, I'm having memory problems, you might just think that there's just something wrong with me, versus being able to know that memory issues is a really big normal symptom for traumatic brain injury.
Yeah. Yeah. I mean, I guess the black and white following rules thing, which you've touched on a little bit already. Can you speak? talked a little bit about it helps with like trust and control, but can you speak a little bit to that and how maybe Will can maybe not correct that pattern, but provide tools to sort of make him feel better about that pattern?
Yeah, I mean, I think there's an element to black and white thinking that's that leaves perhaps less room for error or less room for messing up, which is something a lot of people who have been through trauma and people who have brain injury really worry about. They don't want to mess up. They don't want to make a mistake again. And so I think sometimes if that black and white thinking is like leading you to routines and leading you to structure for your day-to-day life, that can be a really good quality. He, I think, alluded a little bit to like talking or thinking of black and white in rule following. And and I think that there's something that can be taken away from that, which is like, again, following rules might lead to not getting in trouble or not hurting someone. And those can also be things that I think people with brain injury think a lot about, is like how other people might judge them. And so wanting to really stay in the path of doing something right. And so, I think there's doing that to a certain extent that's healthy, and then there's doing it to the extreme, which can kind of hurt us, because if I'm working so hard to fall within the lines and do everything right, then maybe you get less of me as who I am. Like, I don't let myself ever be in the gray.
Yeah. Is there something he can do or we can do to kind of step into the gray and feel better about it and be more authentic as a result?
I mean, I think in this example that Will gives, like being in the gray can mean a lot of things. It can mean, um, not always knowing, like specifically with how someone might be judging you if you didn't do something perfect or didn't do something exact. That like that's actually really human. And even people who don't have brain injuries make mistakes or do something pretty good but not great. That is kind of being in the gray, and it's totally fine. And so sort of allowing yourself to get used to that by perhaps resisting some of the behaviors that may have been really falling within the black and white before. So that might be like when you go to the doctor's office and they have mints on the big bowl right when you walk in, and you took two, and really in your mind it's like, I should only take one mint. It's like, it's okay to take two mints, it's okay to take 5 mints. A lot of people do, I do. I
You,
love to take
I know
five
you're
minutes.
a five minter.
I love it. I love to have one for the road, one for the, once I get home.
Little surprise later. Maybe you
Surprise.
pull it out of the washing machine after you've washed your clothes.
Yeah. But I think sometimes, like someone with a brain injury, and again, I put myself in this camp not that long ago, maybe a year or 5 years ago, I may have taken those 5 minutes and then been like, oh my gosh, someone probably saw me do that. That's not okay. That was wrong, blah, blah, blah. And be really stuck in my head thinking about that. And so for me to be in the gray would to be like, notice that thought and just tell myself stop, and then, you know, let
Yeah.
it go.
And that's why you're a successful cat burglar now, in addition to therapist.
Yeah, something like that.
Well,
Um,
we talked a little bit about like I check the locks before bed like
right.
5 times.
Yeah. Yeah.
And I'm trying to get better about, okay, I know I locked the door. I know I locked the door, but it's still something that's like day to day I'm kind of like, did I lock the door? You
Yeah.
know? So,
That's an amazing example, because I think that some of those OCD behaviors can really show up for people with brain injury because, again, wanting to make sure you're safe, wanting to make sure others are taken care of or safe, and sort of a little bit too of that, oh my gosh, what's the word? It starts with an S. Suspicion, right? Suspicion, which is a symptom of brain injury. And so worrying, not only like being suspicious of myself, did I lock the door or didn't I? Right? And being really wanting to know for sure, because a lock means I'm safe. And sort of being in that mental space where you're like, did I or did I not? And so like you said, you're noticing that you're checking the locks up to 5 times. That started out as sort of a black and white thought, like it's right to have the locks clicked together, and it's not right to not have the locks locked. And then I need to make sure that I did the right thing by locking the lock. So it's telling you the obsession is not knowing if I locked it, and the compulsion is checking the lock. And so in order to be more in the gray for that, you might have to really ask yourself to just, again, like I said with the thinking, it's like stop yourself. So you want to check the lock and you maybe did lock it. You're probably going to be okay either way. And so stopping yourself from going up to do that second check.
Yeah. I guess on the heels of that is kind of imagining the worst case scenario. Do you think that's a component of this, or is that just my own individual crazy?
With the black and white thinking,
Yeah,
catastrophizing
yeah,
is
because
the
I think
most
it's like,
black,
well, if
right?
I
Or is
don't
the,
lock the locks, then there's
yeah,
going to be a home invasion, and
exactly. Well, so how bad would that be? That's the worst. That's the really bad. So it's like if one side is light and the other side is dark, or one side is bad and the other side is good. It's like think about it like that. And so I think that's a great example. And I don't want to go too far, but like negativity bias, right? That's very true of human beings. That's how our brains are wired to like notice what's negative, focus on that so that we can continue evolving and we don't get hurt and we don't die out. And so there's an element of like when something happens that's bad, seeing it as bigger, and your brain thinks it's protecting you. And I think especially a brain injury brain, it's like whatever you were already doing pre-brain injury is magnified post-injury. And so that's another really good example, is like catastrophizing things. Yeah. And so it's really playing with yourself and talking to yourself and
playing with
stopping
yourself, huh?
yourself.
I'm good at that. Okay.
Oh gosh, TMI, TMI, TBI. Um,
I
yeah.
know you're saying, sorry to make a joke of it, but like,
No, no, I think it's okay to joke. That's the whole point, is
right.
like know thyself. And if you have a brain injury, know that your brain wants you to focus on bad things, and wants and is going to get you stuck in that loop with some of that for you, checking. And it's not uncommon if you have a brain injury to be stuck in some of those loops. So you really have to resist it by simply not participating in that cycle of, in your brain, did I check the locks, and just you tell yourself stop right there, versus getting up to check, and then maybe that feels kind of good,
Yeah.
and then you'd keep doing the cycle.
Yeah. Okay.
Yeah.
I know Will also was asking a little bit about long-term memory, to which I think
Yeah.
we've discussed that neither of us really knows what that means. But I meant to start the podcast today with the way my grandmother used to greet me every time I saw her as a kid, which was to say hello, hello, hello. But I totally forgot.
Oh my gosh. Okay. And I would have then, if you, especially if you told me my grandma used to greet me this way, I would have greeted you the way my grandma used to greet people. How's your liver? You know the response, right?
No.
Bouncing.
Bouncing? What does that mean? I don't even.
Look it up. Look it up. Um, yeah, I love that we went long-term memory to grandmas.
Yeah.
But memory in general is a big issue for folks with brain injury. So, yeah, and there's medications that can sometimes be helpful. There are some small skills that you can actually learn, but I think a lot of it just comes down to like, how are you keeping notes of what you've been doing and
Yeah.
what's important to you? And
I think I mentioned I will take pictures of the day just just for memory purposes, so I can
yeah,
kind of like
yeah,
jog my memory for things that happened like 4 years ago or 3 or 2 or and sometimes just for shits and giggles I'll like look at my pictures from years ago and try to kind of jog those visceral memories associated with the photos.
yeah. I love that. I think that's what's so great when you come to a place where you accept your brain injury is that, no brain injury is the same. And different things are going to work for different people. Like we're all kind of figuring out what helps our brain. And I love that you're sharing that on this podcast because I think that's like the picture taking or leaving yourself voice memos or jotting things down, like those are all different tools. But when I hear like taking pictures really helps Zach, like it makes me want to give it a try. I mean, it's hard to imagine that not kind of jogging a memory or at least making me feel happy when I see a picture from a happy moment if my long-term memory is kind of suffering.
Yeah, cool. Yeah, and I think that's what this whole, other than an excuse for us to rib each other weekly, we want to connect with people who've had similar experiences to us or loved ones who have people in their lives who have this on their, baseball card, so to speak,
Yeah.
now, and just try to connect and develop a little more sympathy and empathy for moving through the world with a little unexpected adversity. It's like, I feel like the most vanilla way
Yeah.
to put it.
Yeah, absolutely.
So, I think today we talked a little bit about your a quick summary. I feel like there's so many components and chapters into your journey that we will dive into and I will ask more questions about as we continue. And, we talked to Will, who we're so grateful that he called in and was
Yes, please more
vulnerable
calls,
and
people. Please
shared.
more calls.
If we can figure out how to do the calls, we want more calls.
The number is linked right here. Call this number and leave a message.
But yeah, we talked about black and white thinking and rule following and some long term memory tips. And, we're excited to be sharing these conversations with you. We're going to be covering a new topic related to TBIs each week, going over listener submitted calls from real life situations. We'll be releasing
Number
episodes
right
every
here.
Tuesday. So please subscribe to make sure you don't miss any of these fun and important conversations. If you're planning to have guests, let them know I wasn't supposed to say this part. Um, the content in this podcast is for informational and entertainment purposes only, not professional advice. And we, the hosts, are not liable for how listeners use this information. If you need more support, please contact a therapist or your medical provider, or reach out to us and we can help connect you to somebody. If you are having suicidal thoughts, please text 988 for support. Maria, thank you so much. It's wonderful to see you. I love your frilly pink shirt. It looks great.
Do I look like a clown?
No, you don't look like a clown.
And I like your sheep fuzz jean jacket.
My Sherpa,
Your Sherpa. It's
my
so
surfer
California.
Sherpa.
Your
Yeah,
Sherpa Sherpa.
for the 90
Um,
degree weather.
okay, brain injury, main injury. I'll see you on the flippity floppity.
Okay, bye.
Peace.